Welcome to those of you just joining us. Our upcoming panel explores food and dietary supplements treatment for depression. Get ready to gain valuable insights from our experts, Dr. Naidoo and Dr. Drew Ramsey with Dr. Charles Platkin. Stay tuned.
Dietary, what a wonderful keynote. I'm so glad you were able to make it today and offer those inspiring words. Dr. Ramsey, Dr. Naidoo, thank you so much for joining us today. To begin, I wanted to delve into the prevalence and impact of depression and mental health issues in the United States and around the world. Could you kind of clarify some of these things and give us some more understanding?
Charles, I was actually interested that you chose depression, and I think I do understand why. It is a very, very common disorder, and I think it's a leading disorder that leads to disability worldwide. But it turns out that anxiety disorders have increased by 25% after COVID. A study published in Lancet showed that after COVID-19, anxiety disorders grew from about 298 million people affected to about 374 million people. But I think even Dr. Ramsey will agree that when we treat individuals, there's so much overlap between depression and anxiety. But I do want to point out that there is that subtle difference that anxiety is burgeoning, but very often even the treatments, as you know, pharmacology and psychopharmacology-wise are very similar. So I think that I'm really grateful that you are drawing attention to this.
That's great. And so Dr. Ramsey, do you have an idea of what the scope of depression is in terms of, and also what's the difference between clinical depression and just being sad or, hey, I'm depressed today, or in fact, last night on my phone with my daughter in college at Cornell, she was saying how she's depressed and, and she has high anxiety. So what does that translate to?
Well, I think from Uma's new book, it translates to some great menu items. And I think from the research, it translates directly to her college cafeteria. I think in terms of and we'll talk about some of that research later, in terms of scope, which I think is your question, mental health disorders are, I would say, worse, bigger in terms of an issue epidemiologically for us worldwide. That question you have, like, what's the difference between depression and feeling blue? Boy, it's hard to know these days. We have our diagnostic criteria, but I think going on with what's going on in the world between COVID, the Ukraine war, the Israel-Hamas conflict, I think everyone's really struggling with their mental health and more interested in it than ever. The reason we're facing, I think, a different battle in mental health is the disorders strike earlier. We mentioned depression and anxiety. Those are the ones we like to talk about. We have a lot of colleagues, former colleagues from OMH here, where I worked for years. We have to remind ourselves 1% of the population has schizophrenia everywhere. Right. And so when we look at the top 10 drivers of disability, as Uma notes, depression is number one, but we have suicide, alcohol use disorder, anxiety disorders. And so with facing one, the stigma, two, stigma about treatment, It's pretty easy to treat depression. Maybe not everyone responds. Let's say 60% to an antidepressant. 60 out of 100 people whose depression is treated for $10 a month with an SSRI. I mean, that's not optimal treatment, but for some people that certainly happens. We have so much stigma. So we face stigma in terms of the numbers, as Uma notes, that they're getting worse for a lot of reasons that we'll talk about. And I'm excited to be with you to talk how food and modern nutrition is driving some of this and part of some of the solution. But big, growing, stigmatized, and difficult to treat, and then a lot of misinformation that all of us in mental health know that we're facing.
And in terms of looking at food and dietary supplement treatments, we know there's psychotherapy and we know there's pharmacology. Is this an integration? Is this because I think a lot of people think about this when they think about treating depression and anxiety. They think about, I could just take a pill, and some people just don't want to take a pill, right? They don't want to go to psychotherapy. They want to simply take dietary supplements that they see on TikTok, or they hear from a friend that omega-3 is going to impact you. How does this? Is this so? Again, in your view, you're the two world experts on this topic, okay? And we'll get to know what nutritional psychiatry is in a moment, but how does this work? Again, is it an integration? Is it a this or that? Can it be a this or that? And I'll leave it up to you two to let me know. We could start with you, Dr. Uma.
I think that's a great question, because I think it's not something that many people understand, because most often traditionally, if you're seeing a psychiatrist or mental health provider, you're getting a prescription medication and hopefully also getting counseling as well, because I think the two are very important. I founded and direct the only academic center clinic in nutritional psychiatry, nutritional and metabolic psychiatry in the US. And the principle that we really based our care on is an integrated and holistic approach, with also looking at functional causes for what's going on with the individual that we are assessing. And the reason being that this is intended to work alongside any other clinician referring a patient to us, any other situation or clinical condition that person is experiencing, and it's meant to be an integrated approach. It's not meant to be an either or, and the reason I say that is we have to be careful in mental health. Suicide is a huge issue, and these days people are incredibly lonely and suffering in a very different way post-COVID. So I feel like one of the things we want to separate out and distinguish is that when someone is acutely mentally ill and meets criteria for being in an emergency room or needing acute emergency care, while nutrition can always be extremely helpful to them, it's not going to be the leading thing that we offer them, because they may need actual acute treatment to stabilize them for their safety, etc. But the rest of the time, everyone can actually benefit from these alongside whatever else they're doing. And there are also a large cohort of individuals now who are coping, but really need some tweaking, and they realize tweaking of their diet, because they realize that nutrition is playing a role in this. They've understood the connection, and so they're coming in really just to work on that. So my clinic covers all of those spectrums of things, but we always work in an integrated approach.
And yeah, sorry, Dr. Ramsey.
But I was thinking, people call me a nutritional psychiatrist, but also I think I'm an integrative psychiatrist. I'm primarily a psychotherapist in a lot of ways. That after doing this for 20 plus years, I really like sitting with people and getting to know them very well, and understanding how food plays a role in their life and in nourishment. I think we want to kind of take one step back and think that food isn't a treatment. Food is a foundational piece of our mental health, and we've not considered it that. We encourage people to eat foods that are bad for the mental health. We have a culture that's obsessed with foods that are bad for our mental health. And we revolve kind of working with food in a culture that is just now starting to think about mental health. So the idea that we have data, like we have criteria or recommendations from the top experts in nutritional psychiatry to prevent depression. And when we think about who are the, where are the top places, like shouldn't that at least be 15, 20 minutes, half an hour on every college campus? Right? The president of the college comes to the cafeteria and says, hey, everyone, there's French fries here, there's burgers here, but we've also got this Mediterranean corner. because of this data saying you all are going to struggle with your mental health over the next 4 years, and we want to prevent that in some way. We don't know if this is going to work, but we want to try. We need your help. We need you to engage. When we do that, and when the researchers look at that over the next, when they integrate a food program into college mental health, there's a significant improvement in prevention of mental health disorders. And so in terms of how we integrate, I think first is understanding we don't want to think about nutritional psychiatry as treatment first. We want to think about it as prevention and lifestyle around mental fitness first. And then I think in terms of treatment, how do we integrate it? One is that we have to understand a lot of mental health care is not happening with me. I'm a private practice psychiatrist. We visit a top academic medical center. We both see patients a lot, but a lot of mental health care advice, as you know, is given in TikTok, is given by college counselors, high school counselors, pastors. A lot is given by fitness coaches and trainers. And so part of our work at the Brinkman Clinic in developing some early trainings in nutritional psychiatry, we trained a lot of psychiatrists. We like that. We also trained chefs. We trained people who worked in schools. We trained nurses. We trained some OTs and PTs, people who are talking with patients and trying to make an impact, but they wanted to integrate some nutrition advice that was based in more science around mental health. And so I think one, gets integrated a lot of places. And then my favorite place we integrated, the first one was Christina Mangurian, who some people know as vice chair at UCSF, but way back when Christina was a public psychiatry fellow at the Audubon Clinic. We integrated it at the Audubon Clinic we served lunch at our day program. And we sat everyone down and we said, food and mental health are related. A lot of people are struggling with metabolic syndrome. What can we do differently at lunch? We had a little focus group, and we started adding in more brown rice. We started adding in more veggies and more rainbows. And we started trying to at least have nutrition be, one of those things. It's not the only thing. I think people make that mistake. It's not all gluten, right? Gluten's interesting, but that's not the whole thing. And so we want to integrate appropriately, and we don't want to mistake it it works for some people for treatment, but it's a part of treatment.
And just stepping back slightly, because many people in the audience may not know the term nutritional psychiatry or nutritional psychology. Can we come up with some sort of broad sweeping definition? I mean, you kind of touched upon it, that it's an integration, but it's really a new term for many people. So
it's a new term, and I think we also find a little different for me, because I'm a food guy. I'm here on this earth to help you eat zucchinis and lentils, and I like the data about omega-3 fat, but what I really like is your anchovy recipe. And so I define nutritional psychiatry as it's the use of food to optimize brain health, because I like this idea that it's 5 out of 5 out of us. It's not 1 out of 5 people have mental illness. It's that all of us have brains. They're a little fragile, especially these days, and they all need better nourishment. And then in the treatment and prevention of mental health concerns. And I like calling it concerns, because what I find really fascinating about this work is I'm talking to all kinds of groups that as a psychiatrist, they'd never invite me to talk about depression or anxiety. Nobody's going to ask you like a wellness hour at a fancy bank or whatever. But when it's like foods to fight anxiety, foods to fight depression, foods to optimize our mental health, people are interested. And then we're having a conversation about mental health, and where and I can layer in a lot of psychoeducation about how to take care of yourself.
Right, and that's part of that integration. Sorry. Dr.
Yeah, so I totally agree with that. And I think that I see nutritional psychiatry not at a point of being prescriptive yet, but I also have the hope that as we do the ongoing research, we've just recently published a few days ago a paper on the use of omega-3s in a trial that we did. And I think that as we commit to doing more research and as we commit to doing more clinical work, nutritional psychiatry continues to be at that integration of the use of healthy whole foods and nutrients to improve your mental well-being. And when I say prescriptive, what I'm referring to is the hope that as we try to bring the food as medicine movement forward, especially in the United States, and especially as we continue to train more clinicians, we released a course in nutritional psychiatry at Mass General, and it's really intended to be for, and it's CME accredited, to be for any clinical person. It could be of any specialty. It doesn't only have to be a physician, who can learn to integrate at nutritional psychiatry 101 at the basic level, how to integrate this into clinical practice. Because we have to start somewhere to grow the movement, right?
And what does that look like? Because I'm just going to go through some of these things in just in my notes that, for here for a second. So epidemiological studies have consistently demonstrated a link between nutrition and mental health. Systematic reviews highlighting that healthy dietary patterns rich in vegetables, fruit, whole grains, nuts, seeds, and fish, and limit processed foods are inversely associated with risk of depression. Diets, we just did a whole segment at the Center for Food as Medicine on ultra-processed foods with Kevin Hall and Marion Nessel, which is anybody could see on YouTube. And there's a direct link between ultra-processed foods and mental health issues, such as depression, anxiety, and so forth. Deficiencies in essential nutrients like B12, omega-3 fatty acids have shown to impair mental health and cognition. So when we talk about prescriptions and also and how we integrate this and how psychiatrists integrate this and Dr. Drew, how you talked about just before, in a cafeteria, coaches, there's so much out there. How does this get into healthcare providers' hands? The research, when I just did 5 months, I'm working on a new book on food as medicine. I just looked for 5 months on anxiety. And I tell you, it was not an easy task, scouring through the research. And it was confusing for I had 4 research assistants working with me, and it was confusing. And it was confusing, we looked at impact factor, which for those that may not know of a journal is its credibility factor, or loosely defined version of its credibility factor, how many citations an article has, who wrote the article, whether they were funded by the food industry, and all those kinds of things that come up. And, it takes a lot of experience to be able to scour through that. The layperson doesn't have the ability to do that. So it's expected that experts do that for them, like you and Dr. Ramsey and Dr. Naidoo. So how does the layperson do this? How do coaches do this? How are academic institutions supposed to impart this wisdom on their students? How a medical school is supposed to impart this on their medical students? And now I'll shut up because I could breathe through the whole hour talking. So.
No, that is a really great question. I think the public and even clinicians being able to distinguish and tell apart proper research and proper researchers, proper data from stuff that's just on the internet. It feels a little bit these days, I don't know if Drew is experiencing this as well, but I feel like anytime I am looking at something on social media or on the news, everyone is talking about mental health. And it's so important, for reasons that we've outlined already, to actually go to mental health providers for mental health, because, unless you've counseled someone off a roof, unless you've actually dealt with actual suicidal ideation and worked with individuals who have been in the depths of psychosis, and you've been trained and you understand that there are ways that you can counsel and help them, you don't really know mental health. And I say that with all due respect to everyone who is actually trying to bring the work and support towards those who are struggling with mental health. But I think the worry I always have is that if you are not trained and you don't have that knowledge, you may miss something that is clinically really important and could mean the difference between life and death for that individual. Something like an eating disorder can be lethal in a person. And one of the things in nutritional psychiatry that I have to be very careful about in my clinic is that someone who has a healed eating disorder can certainly use nutrition as a positive strategy. But someone who's in the depths of severe anorexia, for example, is unable to really use the nutritional strategies that I can provide because their difficulty is really that relationship with food. And that condition can actually be lethal. Many people don't often realize that. So I think that when you are looking at research or you're looking at a training program, you have to look to see if they're well-vetted clinicians, if it's from an academic center, because when you create a program at an academic center, let me tell you, about a year of that preparation is going through all of the different levels of academic committees to approve the content that you're putting out, what you're actually saying in your videos, the editing that goes in. And so in order to then create the CME credits for clinicians of different disciplines, they assess all of that. So that is usually a pretty decent standard to go by. When it's a research article, I think you make an excellent point. Always look to see the conflicts of interest, because if the articles about artificial sweeteners and it's funded by Diet Coke, there may be a conflict there. So you want to make sure that the researchers and their funding is clear of conflict. And when it comes to, social media, you really have to vet the source of the information very carefully. And I think that's where I worry about teens and younger folks and those who are, say, not in the clinical world, like many of the people attending this, who may not be able to tell that apart because they're very vulnerable.
Right. And Dr. Drew, just before you go, I just want to read this, and then I would like you to respond to it. It's similar, but I wanted to read what I had, the original question I wrote, because I'm doing a lot of this just extemporaneously. In an era heavily influenced by social media, the prevalence of quick-click headlines and influencer-driven content makes the accurate interpretation and evaluation of information about food as a therapeutic tool both challenging and crucial. Many influencers lacking in-depth training may not fully explore the extensive research when recommending diets related to mental health issues. Additionally, I observed that once reputable magazines, because every week I do a news and research digest that goes out to 115,000 people. And that research digest, I see like Sports Illustrated, Discover Magazine, Time, Newsweek. They're using clickbait, basically. And most of it is around mental health issues. So I noticed that they have articles about lists of supplements that'll improve your mental health and improve decrease your chance of Alzheimer's, all with a lack of research. And, and experts in the forefront, as you two are experts in the forefront of psychiatry, nutrition, culinary arts. What advice, and this is where it's a similar question that I just asked. So I'll lead this to you, Dr. Ramsey.
Well, thank you. I think that there's Uma makes a lot of great points. I probably disagree a little bit in the sense that I am prescriptive because I'm a clinician sort of out in the world, not centered primarily in academia. And so there's a way that everybody I meet for the last maybe 15 or 20 years, I ask them about everything they eat and I give them some ideas based in whatever research is emerging. Since I started doing this, there have been 7 randomized clinical trials, all small, finding significant improvement when people are given mostly a Mediterranean diet. And so I think one of the things that we're struggling with in mental health and in food and mental health is that a lot of it is very straightforward. It's inexpensive, it's simple food, it's not based in superfoods, it's not based in anything that's that complex. If you look at the criteria for the prevention of depression, which you'd think everyone would be fascinated, interested, like how can we prevent depression with food? None of it's going to surprise you. Right? Eat more vegetables, eat less processed food, eat some seafood, eat whole grains, right? Simple advice. And so sometimes I think that because we're in such search for data to tell us what is very simple, people have started radically changing what humans eat. We eat a lot too much and we eat the wrong food categories. And in terms of what to do about it, I think we all have our own calling. I've been just blown away that Uma is the only nutritional psychiatrist with that phrase in America in an academic appointment. Others of us, I've been singing and dancing on no dancing, I didn't get to TikTok, but I've been on social media since the very beginning. I got the APA to join Instagram. I got Columbia Psychiatry to join Instagram with the notion that if we do not get mental health messaging out there to give somebody at least an alternative, we're not doing our job. If we can't explain mental health in a cool visual picture or and it's been amazing over the last 15 years to see this huge growth that does a few things. One, it shows the diversity of mental